Good afternoon, everyone, and happy Friday. We're so glad you could join us for our last beauty care series of this few week education that we've done. If you want to check out any past speakers, we have them all posted on our YouTube page so you can catch any that you've missed. My name's Caitlin, and I am the Assistant Director Institute of Beauty and Wellness in Milwaukee. If you could join us today for our speaker, Thao. She is a cosmetologist, esthetician, and cosmetic tattoo artist. She's been in the industry for 20 plus years and has been microneedling for 15. For the past 4 years, she's been working with ProCell, where she's a rep, trainer, and service provider. Now we'll turn it over to Thao.
Hi everyone, thank you so much for having me. It's my first time doing a webinar, so I'm a little nervous, but I'm here to help with the topic of microneedling and the benefits and sort of the brief history and how I kind of got started into it. I think that it's here to stay and it's definitely not going to go away anytime soon just because of all the amazing benefits that it has without any too much downtime or anything like that. So thank you for the introduction so much. So yes, I've been in the industry for about 20 plus years, and I actually started out as a makeup artist before that, and then I did cosmetic tattooing and then skincare about the same time, and then I learned, I was taught how to do microneedling by a doctor in Hawaii who was one of my mentors, and she was also into cosmetic tattooing. So I studied underneath her a lot. And I basically started out doing scar camouflaging. So, and then it just got to sort of evolve into helping with um, just helping regular healthy skin to improve regular healthy skin besides just doing scar revisions. So I'll do like a sort of like a brief history of microneedling. It actually started a very long time ago, but it's first documented by in 1905 by a German dermatologist and Dr. Ernst Kromeyer, and he actually started doing like skin abrasions using like some dental burrs, and basically it just sort of like breaks up like the tissue just a little bit. But he started treating like scars, birthmarks, hyperpigmentation, and then he realized that it just helps a lot just doing slight abrasions, just piercing the skin just slightly at the surface. And then in 1980, Dr. Philip Simonin actually started using acupuncture needles to actually help improve the skin quality. I think it's just like overall skin. There's not much about him, but I'm just kind of going down sort of like the timeline just a little bit, just to give you again the brief history. And then in 1995, it's actually by two major doctors, Dr. Oren Trike, and he actually developed the surgical method for inserting hypodermic needles into the skin through like just very tiny skin punctures. But that was more. But in 1996, is actually Dr. Andre Cameron, and he actually started doing treating scar revisions by doing scar camouflaging, treating skin with doing tattoo, you know, uh, cosmetic tattooing for the skin by using skin pigments to help with the scars. And then he realized that it wasn't the pigment that was really helping the skin so much, but the needles themselves. But he discovered that using just regular tattoo needles without ink really helped improve the scars for post surgical treatments. And then in 1996 again is by Dr. Des Fernandez, and he sort of pioneered the derma roller. So he created and developed the first derma roller, which is very common. You can get that anywhere. And he also used hypodermic needles as well, but he just really became the first person that was really known. He actually founded the Inference skincare products, and I actually remember getting the first derma roller that he had like a long time ago. Um, and Dr. Lance Setterfield actually is sort of like paved the pathway to include microneedling into the medical field. If you want to know more about microneedling, he has written several books on microneedling, and it's called A Concise Guide to Dermal Needling. I've met him a few times, and he's a super nice guy, and I think he has like webinars too. So that's the brief intro to skin needling. So as we age, I just want to go over like the skin and just the brief anatomy of it, and that helps with like how microneedling helps our skin. So as we age, we do lose the elastin, the collagen breaks down, and our body just doesn't make as much collagen as it used to. And that process slows down like after like 25, 30 years of age. And there's like two types of skin aging. There's the intrinsic and extrinsic. So intrinsic is determined by our genetics. And our genetics only account for about 10% of aging, and the extrinsic is more of like a lifestyle, external factors, and that's sun exposure, not using sunblock to protect our skin. That's also with poor nutrition, lifestyle, basically lifestyle. Drinking and smoking contributes to aging as well, and certain medications, and just poor hygiene. And the extrinsic counts for 85% of our skin aging. So we definitely have a lot of control over how we take care of our skin and how we can improve it and maintain our skin care and the quality of our skin. Um, so, so microneedling it basically is like a multi-purpose skin treatment that targets acne scars, hyperpigmentation, wrinkles, fine lines, and also even hair loss. So for those of you guys that are in the Academy for Hair, you can definitely help your clients know that there is a treatment that helps improve hair density, and that's microneedling, where some people are great candidates for it, and that's more like hair thinning. So if someone is kind of like at the stage where they're bald, that really doesn't really help, because you need some healthy follicles, so I'll get into that a little bit later after I go over just like how it helps with our skin. And hair is pretty straightforward. So is skin, but there's just a lot more to it with hair. With skin as opposed to hair. So the skin needling basically is just using tiny short needles to puncture and perforate the skin to create little microchannels. And so it tricks our body into thinking that it's damage, but you're not really damaging it. Again, just because it's minimally invasive to, and if it's, of course and I'll go over like the different kind of microneedling devices, because that really makes a difference as well. But it's using tiny needles to perforate the skin, and it creates a slight bit of like inflammation, which actually sends signals to our body to actually starts repairing that area. So once it repairs that area, you are creating more collagen, more elastin, and the newer collagen replaces the older one, and that's actually the stronger and collagen, which results in firmer skin, so and smoother skin as well. So basically, it's like a control skin injury without actually damaging the epidermis, and these and you're only really just treating like the stratum corneum, which is like the outermost layer of the epidermis. So our skin has three major layers. It's the epidermis, the dermis, and the hypodermis. And the stratum corneum is just the outermost. So you don't want to go too deep, or else you could actually really damage the skin and cause scar tissue, and that's kind of defeating the purpose of doing this treatment. Um, so through the healing response is when the fibroblasts is actually what increases the collagen production, and um, and that is what helps with the skin improvement, the texture, the collagen, and all of that. It also releases our own growth factors as well. So with uh, since I've been doing microneedling for 15 years, I've used so many types of devices. I actually started out doing using my tattoo needles and that's what I was taught by the doctor that I was with. And so I use the tattoo needles, and then there are more companies that actually making microneedling devices and like let's see, Rejuvenation, Derma Pin. I actually have some that I can show you guys. But about 4 years ago, I actually I stumbled upon this company called Pro Cell Therapies, and their device was much different than the others. I'll show you. This is actually a derma pin. This is actually what most of it. Oops. What most pins actually look like. It's just a regular pin. It looks kind of like a tattoo device, and that's actually what it was derived from. And I I don't have a cartridge just because I haven't used this in a very long time. But it's adjustable, um, and which really doesn't need to be adjustable at all, because the way that these companies tell you to use is actually to drag or glide the needles across the skin, which is actually it's not a very good technique, because you're just scratching the skin, as opposed to this is like the ProCell device. And so it looks very different. It looks kind of like a gun, but I just call it a tattoo device. But I like it because it sits right here, and then this is actually the needle. And I also like it just because it has three um, cartridges, and it's the only device out there that has three different cartridges, and it has so you can use it for scar revision for all over the face, and then there's a tip for the body too, which actually helps with stretch marks, larger scar areas, and so it's actually, I'll turn it on for you guys. But I also like it just because it's also cordless, and just a battery right here. So that's what I use, and I also train a lot of new practices to using, and a lot of them have switched over to using the ProCell device, just because it actually least invasive compared to the other devices, just because the mechanism is actually you're tapping in a linear 90 degrees up instead of like gliding the device. But anyway, that's what I use, and that's what actually I train a lot of the medical practices, and also estheticians as well. Um, so that is it's just a little bit of on ProCell. If anyone has any questions, please feel free to ask me. And as far as the contraindications for the treatment, you definitely don't want to work on pregnant women or women that are still nursing, and it, especially if you're using numbing, because that could definitely um, it's just not safe to actually work on pregnant women. That, and even though that it's actually the most organic treatment, where we're using just needles to penetrate the skin, and also the device is like the delivery system, and but it's actually the magic is actually the serums that we use. And the serum is a combination of growth factors derived from bone marrow stem cells and hyaluronic acid, two ingredients that our body already knows and recognizes. So there's no way that anyone could ever be allergic to it. And but still, that's, you just don't want to work on pregnant or nursing women at all, just in case if anything ever happens. The other contraindication is those with very active acne, like the flare-ups, like the pustules. But you can actually work on those with cystic acne. So, because it basically decongests the skin and opens it up so your skin heals a little bit faster. Now, I have worked on those with like a little bit of a breakout, and it does help, but you don't want to work on someone that has like a major flare up where it's, mainly covers like 60-70% of their face. And it's not about, it's more there's, because they have such a large amount of flare-ups, their skin is so inflamed already, so you don't want to do a treatment that exacerbates and increase that inflammation. The protocol for that is that you want to do some kind of mild chemical peel, and give it like 12 to 14 days for it to heal, and for that to actually calm down the skin a little bit. Then you can do a microneedling treatment to help improve the skin further. Um, so microneedling is amazing for acne scars, and just basically any acne, but it actually started out treating acne scars. Even hyperpigmentation, you can actually break up the dark spots, and your skin will actually um, heals from underneath. So there's healthier, newer collagen. So it pushes the top layer out. So it's also increases cell turnovers. So it's sort of like a microdermabrasion in one, but it's more with like, improving collagen more so than skin resurfacing. Um, I'll go over what other treatments that you could actually um, combine the treatments with. You can do a dermaplaning treatment right before a microdermabrasion, but definitely evaluate your client's skin first, because not everyone will be able to do those two treatments together. So for like my skin, I can definitely do a microdermabrasion or dermaplaning before micro needling, just because my skin is pretty thick. But everyone's skin is so different, so make sure that you evaluate each person, and everyone's treatment is going to be very different, and how they respond to the treatment is also very different as well. So the needle depth actually for the is, ranges from like 0.25 all the way up to 2.5 millimeters. And when I train at the practices, the way that our device works, the Pro Cell versus other ones, is that you can get great results doing 0.25 and zero point 0.5 treatments. Even my medical practices um, uses mainly zero point 0.5, and once in a while they'll use a 1.5. But uh, now people realize that the more aggressive the treatment is actually not better. Um, and you want to scale it back, just because you want to not overwork the skin. So, and the more damage that you create, the higher the risk of creating, hyperpigmentation and scar tissue. And then, especially those with sensitive skin. So it's always better to be conservative at first, and then you can see how well their skin responds. For some people, you may not ever need to increase the depth, like, using longer needles. I have clients that, they're great at 0.25, and I really don't see any reason to be more aggressive with them. But again, everyone is very different, so just use your best judgment when you work on your clients. So um, Oh, so going back to like hair loss. Basically, when you're doing microneedling for hair loss, you're just basically stimulating the dormant hair follicles. And again, we use a growth factor serum, but there's two different ones: one for skin and one for hair. And the one for hair has different growth factors in there that actually targets the follicles. So when you stimulates the dormant hair follicles, it helps increases new hair growth. And that's pretty much, and you can use for men and women. Um, for the hairstylist, you can actually be a hair coach. There's a great surgeon, Dr. Alan Bauman, in Florida, and he teaches like a comprehensive, um, hair coaching class for hairstylists. So if anyone wants that information, I'd be happy to give you that info. He also works with a lot of doctors as well. So there's two different kinds, so two different classes, actually workshops. But he does have a really great workshop for hairstylists. So you can help your clients for those with hair thinning. And I mean, that is, will be able to help a lot of people. And it's a, again, non-invasive treatment. And besides like this, there's two other treatments for hair loss and hair thinning, and that is like PRP, and then of course, the last resort is hair transplant. So if you could do a treatment that helps help increases hair density and improve hair thinning, and there's no surgery, then why not try that first? And I've seen amazing results from it. Um, and then there's PRP as well, and that's also non-invasive. It's a little bit more expensive, and it is more invasive, but it's still not surgery. So that is basically what microneedling does for the hair loss. Again, it's very straightforward. Um, so as far as like going back to the skin, it's been documented that like those with getting 4 treatments um, with a 1 month set apart, you can actually increase your collagen production in elastin by 400%. And that usually lasts for like your skin will keep increasing with the collagen like even 6 months after the treatments. So you do them for treatments apart. In my practice, I actually have my clients. They usually get treatments every 6 to 8 weeks, and they do it on a regular basis. And that's just because they want to maintain the health and quality of their skin. It's kind of like exercising. I mean, they all have perfect, flawless skin, so they want to really just keep maintaining their skin to be the best healthy and quality skin. But for those who wants to just do acne scars, and that varies with how many sessions. That varies by the severity of the acne, and also how often they come, and also just compliance. If they take really good care of their skin, and by with home care, that also helps um, the sessions. And so, um, but yeah, and so when I also go over the certification of the microneedling, um, so certification is there's really not like as far as aesthetics. I think that more um, aesthetics, esthetician. Uh, gosh, what is it called? I guess, school are more incorporating microneedling. However, I know that it varies from state to state on whether estheticians can do microneedling. Um, I know that in the state of California, which is where I'm from, I'm based in San Francisco, and estheticians by themselves can't really. It's not within their scope because estheticians basically work on the surface of the skin. And but however, getting certified, you can actually get certification in cosmetic tattooing or microblading, and that's actually within the scope because when you're doing cosmetic tattooing, you're using needles, so that's like within the scope with microneedling. Or I worked with a plastic surgeon for about 17 years, so I was able to work with them, but I was also, even if I went out on my own, since I was already a cosmetic tattoo artist, it was already within my scope to do microneedling. So um, those two procedures go hand in hand. And but yeah, I think you just have to check with your state regulations because I know with certain states that estheticians are able to do microneedling, but again, I don't know all the regulations of every each state. Just California, I'm very familiar with. And so that's like, I know that when I train someone with the pro cell, then we actually give them certification for pro cell. So they get a certificate and everything after I train them. And I do hands-on training, just I think it's very important just to be there and watch the provider work and I show them the technique and also how to sit in body mechanics. So yeah, I mean, you can do it with FaceTime and Skype as well. I just like to be more hands-on. Um, so why would you choose microneedling over other procedures for skin rejuvenation? There, for one, it's actually the least invasive, and you could, because you're not damaging the skin, it works with every skin type, every skin condition, and every skin color. So I can actually work with skin from all the way from Fitzpatrick 1 through 6, just because it doesn't damage the skin. You're increasing the health of the skin, and by using it's a very, I wouldn't, it's not really gentle, but it doesn't damage the skin so much. Again, it's just because the needles are perforating at a 90-degree angle, and so it's like perfect perforations. However, if you do actually drag the needles, that is a higher risk of causing hyperpigmentation. So you can really only use that method for skin Fitzpatrick 1, 2, and 3. Um, Again, just be very careful. That's why I love ProCell, just because it's safe to use on every skin color, and I can also use it for those with rosacea and those with eczema and with very sensitive skin. And that's what I like, is that I know that it's safe and it's very effective to use on everyone. And you can use microneedling just isn't limited just for the face. When I do the treatments, I work on their neck and also their décolleté, and I do lots of scar revisions. Again, I worked with a doctor for a while, so I was using microneedling a lot to work on like a lot of the surgical scars, and or just any scars. Scars are just basically results from major trauma to the skin. So um, again, I mean, it's just like such a great treatment because you're not damaging the skin. Um, and also, you want the microneedling, I would pick that over lasers, just because laser is very invasive, and because it's invasive, you're limited to who you can work on. So in my office, in order for me to use laser, I have to pre-treat my skin just because I've got Fitzpatrick force. So I have to pre-treat it by using retinol or hydroquinone to kind of like light my skin. But again, with microneedling, you don't have to do that. So a lot of my clients really like that better over the lasers and whatnot. Skin peels are great, but again, that limits to like what type of skin you can work on. Most of my clients started out with doing chemical peels, and now most of them just they all opted to do the microneedling, microchanneling instead. And I like it just because I have much more control over what I can do for them, and versus the other treatments. So that's why I choose microneedling. That's actually what I do mainly with my practice of my clients. Besides being tattoo artist, I do mainly microneedling and microchanneling treatments, and also I combine it with microdermabrasion, um, and dermaplaning is great to combine with that as well. What you don't want to do is combine chemical peels and micro channeling. You want to space that apart. Um, but as far as like a treatment that you can combine, dermaplaning, microdermabrasion is great. Um, and again, just make sure that evaluate your client's skin first, because if you want to you can do a microdermabrasion. Like for those with sensitive skin, you can do that about 10 days prior to a micro channeling treatment. And but that's for people with like sensitive skin, so you don't want to combine two treatments because that could be really irritate some people's skin, and usually those with like thin skin or sensitive skin. For those with skin that's not so sensitive, you can certainly combine the treatments, but you can actually work up to combining those treatments, because just because someone has sensitive skin doesn't mean that they have to live with it, because every time you do a microneedling treatment, you're increasing the collagen production. So the more collagen you have, the firmer and stronger skin that you have. So, sorry about that. Um, So yeah, that's pretty much micro channeling, micro needling in a nutshell. And let's see what else I can cover. So I guess sort of like the micro channeling in a nutshell is just basically, I mean, if you want to explain it to anyone, it's basically just a skin treatment, skin rejuvenate treatment that uses tiny needles to perforate or penetrate the outermost layer of the skin, which is the stratum corneum, to help increase collagen and elastin production. It also is a great treatment for acne scars or any kind of scars that your skin has. It's great for stretch marks. I've done a lot of treatments for stretch marks, and the results are amazing. Not only are the clients seeing that the stretch marks are actually less visible, but the skin around it has also improved by the skin is definitely firmer, so it's tighter. So anytime that you do a microchanneling treatment, it helps improve the firmness and the smoothness and tightness of the skin. Just overall healthy quality skin. So but yeah, you can definitely use it on any part of the body. And again, I like the Pro Cell just because it has like a big, um, let me see, it has like a big tip, so you can actually cover a large surface area within a small. I can actually do a stretch marks on the whole abdomen on an average person, probably about 25 minutes to do. So I've trained a lot of medical practices for to do in that, and they like it a lot. They actually like it more than a lot of their lasers. The last large practice that I worked on was a dermatology practice in LA. So I trained them in January, and they were just super happy. They have an alternative treatment to use on their patients, and they told me they liked it so much better than their IPL. So it's just, so I was really happy to hear that. Um, so I guess that's about it. Do you guys have any questions? I don't know. Let me see. Um, let's see. How often do you get the treatment? So, you can get the treatment. You gotta wait at least 4 weeks. It takes 28 to 31 days for the skin to fully heal. So you don't want to do it less than 4 weeks. Again, my clients they get it done like every 6 to 8 weeks, and but they do it on a regular basis. And For them, I mean, they have flawless skin. It's kind of like I see micro needling treatments as sort of like workout sessions. You know what I mean? Like you want to keep doing it to help improve the skin even more. So, when you work out, you're actually and lifting weights, you're actually tearing down the muscle fiber, the muscle tissue, and then you got to wait for to recuperate. And so when you wait after working out, your muscle tissue actually repairs itself, and so your muscle is just stronger. So collagen is the same. So what I compare to is like the collagen to your skin is like the muscle to your body, and you can get the treatments for life. It doesn't thin the skin out, which is what I love. And every time you do it, you're improving the collagen production more and more. And again, it's such a safe treatment, and everyone is able to get it, and that's what I really like. Um, a long time ago, when I started out doing microneedling treatments, um, the way that I was taught by my mentor, and I mean, this is just, before this device came out, is that you do cause more of a damage of an injury because you're, gliding, you're dragging the needle. So you're causing a lot of micro tears into the skin. So the results were great, but I really didn't like doing the treatment just because it was just so messy and bloody. And my clients had to sort of like, you know, we had to figure out some kind of schedule, so they would have like about 3 to 5 days of like downtime. So that was really hard to do because not everyone has that 3 to 5 days of downtime. So now with this particular system, the ProCell, it's so amazing because there's no downtime and they can get it done. I know a lot of my clients, they travel a lot, so I'll do their treatment and they can be on an airplane the next day. And so that's what I love. And for me, I give myself treatments every 6 to 8 treatments, like every 6 to 8 weeks as well. How long is training and how do you get trained? Training is actually, there are like a couple of schools in California that do microneedling training, and they train you, and they on like different devices, and I think I think it varies from 1 to 3 days. It depends on which curriculum. I do training like only on the ProCell device, and that takes like 1 day. And it could take anywhere between, if I'm training one person, it could be 3 to 5 hours. But it depends on how fast you learn as well. So I will make sure that you get trained very, very thoroughly, and make sure you're comfortable with doing the treatment. And also, whoever I train, I'll be happy to do a refresher, anytime. So, let's see, where do you buy the device? Actually, the device you can get through me. I think that, they'll give you my information. So it's Tao at procelltherapies.com, and I'll be happy to assist you with that. And let's see. So that's how you get it in. Again, I love training and people on this device just because it's such an amazing treatment. And I'll be happy to show before and after photos too. It's kind of hard doing this webinar, but how much does each treatment cost? So when I do face and neck, I charge 550 to 650, and that is every like 6 to 8 weeks again. And then if they want their décolleté done, then that's an extra 250. But the more areas that they do in one setting, the better the discount I give them. So the cost varies. So I know that like I work with estheticians, and they charge, usually about like 300 for the face. But now that I train, I really, really encourage those to actually do the face and neck as well. Just because most women neglect their neck, and the skin on our neck and chest is actually thinner than our face. So you see a lot of like women there, they've got like great skin, their face, and then like you see like sort of like their neck and chest, their décolleté, there's usually a lot of like sun damage. So I highly encourage everyone to start doing, incorporating the neck when you do any kind of face treatments, and because the neck is part of our face, right? Um, when I first started out, I was charging 350 just for the face. However, a lot of the practices that I train, they charge, especially the medical practices, they could charge 500 just for the face. And again, it totally depends on where you are. I flew to New York, and I trained, a practice there, and it was not in New York City, but outside of New York. So they charge about 450 to face and neck. So it varies on your demographics and the area. Um, let's see, how many treatments would it take to notice a difference? That depends on the individual, because everyone is so different on how they respond to a treatment. And also, if they don't wear sunblock and take care of their skin, that's also a factor. So you want to encourage your clients to definitely be compliant and take really good care of their skin. And one of the best things that you can do for yourself is wearing sunblock. And the best kind of sunblock is a physical formula. So there's two formulas for sunblock. One is chemical formula, and the other is physical. So you want to definitely stick with the physical, and make sure that the active ingredients is either zinc oxide or titanium dioxide. It physically deflects the sun rays. It's a lot gentler on our skin, and it's a lot better for the environment. Because sunblock is actually not regulated, there are some that actually doesn't even really do much. For me, I work with a doctor, so the ones that I use, it has to go through FDA regulation, and it's got 12.5% zinc oxide. But you can definitely get like really good sunblock just over the counter. Just read the back of it, look for active ingredients, and if it says titanium dioxide or zinc oxide, you're good to go. So let's say if I do a treatment someone and they are, especially for hyperpigmentation, and they're not using sunblock, their results are not going to stay very long, because every time their skin is exposed to the sun, and there's no protection, it's going to really just kind of defeating the purpose of the treatments. So you want to always encourage your clients to definitely use sunblock, and just use really good high quality products as well, because that makes a difference too. And so for like some clients, they can see a difference in one session, and for others, it may take 3 sessions to do. That also depends on how often they come to get the treatments done. So if they come regularly, let's say like consistently, like 4 or 5 weeks, then they'll see the results better than someone who waits for like 8 to 9 weeks to do the treatments. Um, let's see. Is there a difference between this? Yes, there is. So a vampire facial is actually a PRP treatment, and that's platelets-rich plasma. That actually involves, that's more invasive. So a nurse or doctor has to actually draw the blood, and then they actually put the blood in a centrifuge. And so they separate the blood and the platelets, and then they actually inject it back into the skin. And they also use it for microneedling as well. So it's a two-step process. Well, it's more than it's two-step, but they injected the platelets, and they also actually microneedle it onto the surface of the skin. It's typically about 700 per session, and then usually just do the face. Um, One of my practice in Southern California, it's a medical practice, and and most medical practices actually do PRP in their facility, just because it's a medical practice. And so she actually did her own case study, and she noticed that just using the growth factors from ProCell, and also those that she does PRP, and she told me that using the serums are actually just the results are just as good as using the PRP treatments, and it's less expensive, just because you don't have to draw their blood, put it in a centrifuge, wait for it, and so she was really happy to do that. And PRP is great for those that are for individuals that are healthy. So if you are working with someone that has health issues, I mean, your platelets are only as good as you are. So she realized that doing PRP on younger people is actually better than using it on the older, or those with autoimmune disease. Let's see, how often can you get the treatment done? Um, my clients get it done every 6 to 8 weeks, and they do it on a regular basis. For them, they don't have any skin issues. They just want to keep up with maintaining and the quality of their skin. And again, we keep aging, so I mean, you can do 4 treatments or 5 treatments in a year, and if you're happy with that, you can, wait until do that like every year. But it all depends on your client's budget. And if they like, I give my clients a really good price, just because they come every 6 to 8 weeks, and so they get a really good deal. So the more you can do packages too. So the more sessions you can do, like 3 or 4 or 5 sessions, and they could pay in advance, and then just give them a really good package deal. And that's what a lot of practices are doing. um, so the needle can go to 2.5 into the skin. um, There there are the only needles that says 2.5 are those that are adjustable, and that's actually with this device. However, if you are gliding the skin and dragging the needles, you're really not penetrating it at 2.5. I mean, you're still at the surface. The only way that it actually penetrates at the depth that it tells you is if you are going up and down like that. But if you're gliding, which is actually what most of the companies with this kind of device tells you to do, you're really not penetrating at 2.5 or even, point above point 0.5 actually for that fact, just because it's just the physics. So as long as you're gliding, you're staying on top of the surface of the skin. So it's a little deceptive on, the adjustable. And again, it's really not, I've used this, I mean, I started out with the device um, like this, and actually it's actually a tattoo device, and it looks just like this. But this is actually a Derma Pin. This is just for microneedling. But and also remember, the longer the needles, the more invasive it is, and so again, the more invasive the treatment is, it limits to who you can work on. So you can't work on those with um, sensitive skin. You can't work on those with darker skin. And there's a misconception on like scar revisions. A lot of people think that with scars you have to be aggressive, and but that's not the case at all. Remember, scars are results from any kind of trauma to the skin. So if you're really doing aggressive treatments, you could definitely, that treatment could backfire, and you could actually make that scar even worse. So you want to approach it in a very, very gentle and conservative way. And that's, I mean, even one of the medical practices, I tell them like, hey, when you're working with scar revisions, you got to be even more gentle. You got to, it's all technique, So, and that's, where I'm happy. I'm, trained the practices or the estheticians on how to do it on scars. And the technique is pretty much the same, even for hair rejuvenation. So let's see. What kind of numbing can be used for this? The numbing that you want to use is actually a topical numbing. So I use a topical numbing that it's prescription, but it's something that I've been using for 20 years by the same pharmacy. And but with PRP, they actually kind of for the hair, they actually inject the numbing, but it's not really necessary, especially with the ProCell device, again, because it's not really, you're not going too deep. For the scalp, for hair rejuvenation, you want to start off at a point 0.5. And again, that comes with the training where I give you all the details and train you on how to do the treatment, what needles to use, how many sessions, and all that. Um, let's see. So that's the kind of numbing, is basically topical numbing. Um, and and then is the treatment can be used on the body? Yes, you can definitely use it on the body. It's great for stretch marks, like I mentioned before. And reach out to me. I think that Neroli, they're going to give you my contact information, and I'll be happy to go over that. We're kind of running out of time, but I'll be happy to help you additional questions and the treatments. I Again, this is like if you want to improve skin on any of the part of the body, this treatment is great for all of that. What is the difference between microneedling and derma rolling? Derma rolling, there's no difference. Derma rolling is actually just a roller that you roll back and forth. Um, it's okay, but that's more like home use. It's not like a professional. If you go and get like a professional microneedling done, they won't be using that device at all. So derma rolling is microneedling. It's just using a different device, and that's more of like a home care kit. How often do you come in for treatment for stretch marks? Um, Anytime after 4 weeks is good because by then your skin is completely healed and you're ready for another one. Just make sure that skin is, and my average is like about 6 weeks just because I have a crazy schedule and because, sometimes if someone is a slow healer, just give it another week or two, and that works pretty well. Can you do brows? You can do certainly brows, and again, if someone has like brow, and you can actually go right on top of the brows, and that actually helps increases the hair to grow back. Now, if someone has microbladed or cosmetic tattooing on their brows, you want to avoid that area because it actually fades the pigment faster. So I only do it on the brows when someone doesn't have that area, like if their brows aren't microbladed or tattooed, then I would go over the brows. How often to come in for treatment for stretch marks? I think I already answered that. Six, about anytime after 4 weeks. I've been microneedling for about 15 years, and I love it. I've helped so many people with their skin issues, and I it's safe and it's very effective. And so, if I could do a treatment that's safe and effective for my clients, I don't really have to worry about like, oh my gosh, I hope that they get great results, or I hope it's not too much for this individual. Um, so I thank you. I'm so glad you learned so much. There's like so much, but again, I didn't really think that I would actually finish doing the 45 minute or an hour, but I'm glad I was able to help. How many treatments will you need to start seeing results, stretch marks? Um, Again, that totally depends on the individual. If someone has minor stretch marks or minor acne scars, they will see the results faster than someone who has like a lot of stretch marks, or depends on the severity of the stretch marks in the skin. Again, it totally depends on each individual because we all respond to the treatments very, very differently. However, it does work, so just be patient. It's kind of like working out. You can't, you're definitely not going to see results after one or two treatments and be happy with it. It's one of those processes and procedures where it's like cumulative, so it builds up over time. After treatment, do you recommend a home care? Yes. ProCell has some amazing serums that it has growth factors. It also has a combination of vitamins, vitamins A and C. It has a little bit of retinol. So it does help improve the skin with each treatment, like in between the treatments. And we also have a home care treatments now that is great for those where they want to do treatments at home in between, and that's it's not going to be the same as a professional treatment, but it definitely helps. Just like if you hire a personal trainer, even when you're not training with them, you want to still exercise and eat really well. And so when you do go in for your next training session, you will see the results even faster. So, same thing with this kind of treatment. Um, and with lasers and our radio frequencies, you can only do those treatments very like maybe once or twice a year, but with this you can do it like continuously, like every uh, like after every 4 weeks. um let's see. um it was my pleasure. Thank you so much for having me. I hope I was helpful in helping all of you answering the microneedling, microchanneling. Okay, thank you. Bye.